Good afternoon, and thanks for everybody being here today. This is the first time we've kind of did this where everybody's strung out like this, so I guess we're all going to kind of learn as we go here. But again, thank you for being patient with me at the governor's office. Hopefully, I know it's not been the best of circumstances for everybody, but every day we're trying to put as much information out there as possible of what we're doing here in the state and really trying to keep the public informed with everything we're doing every day. A lot of my directors are up here today with me. They're going to be here to help answer questions if we can. We'll try to make sure everybody has plenty of time to ask questions today, that we'll give time to do that. Most of you know have been staying up pretty much every day on the briefings of what's going on in the state of Missouri. I think the most important thing is yesterday when we made the announcement, we're going to start focus on trying to figure out and start putting the phases together and the plan together to reopen the state of Missouri. And I just want to say that in phases. We're going to be very cautious how we do this. There'll be some set of guidelines, a set of rules that we'll follow. We plan on the next week or two, with the help of a lot of people around the state, the local officials, the business people, the employers, the employees. A lot of people have input into that of how we move forward and what those guidelines will look like. So every day we're moving forward. The good news is, in the state of Missouri, things are somewhat becoming stable. Still a lot of concern out there across the state of things that we got to deal with. We're still concerned in that St. Louis region, a lot of things going on up there. But again, testing will become a very important role in how we move forward, and I think you're going to see that expand here in the state of Missouri. I've asked my directors to double that occupancy in the next week to 10 days. I think we'll be able to do that. And I think some of the other important things that we really want to talk about when we talk about testing, and I'm sure there'll be lots of questions about that today, but we currently have over 90 mobile test sites in the state of Missouri. Our goal was to get to 100. And when you look at the state as a whole, when we tried to early on, when I think a lot of unknown for us all, we were all concerned, some scared, trying to figure out how we deal with this, and was trying to deal with it from a state level. I think today, with the data we have that we've been able to receive and really look and see what's happening in Missouri, we've been able to go through that data and realize now we may be much better off knowing what areas to target, where to put some of those resources at. 3 weeks ago, if you remember, we didn't know that it affected the African American population as much as it does today. So now we're able to isolate, we're able to put more resources in that. We know people in nursing homes. We knew people that had health issues, and older people, how much of an issue that is. So we now can be able to take resources and target that. But we don't need to necessarily have everything all over the state at the same time. So that's where we've been focused. I think one of the other things that's important today is really trying to realize when statistical information first come out, I think to remember for everybody in this country, we had never been through the virus like this before, the COVID-19, for as fast as it happened and the effect it had all over the United States. And then I think a lot of the models that were out there, a lot of the theories that was out there, a lot of the people that was trying to do best guess estimates, I want to say, was out there. And at some point, I realized that I really need Missouri statistics to make decisions for the people of this state. And that's what we've really done. And we finally got to where we're pretty comfortable with it, know what those stats are and how to accumulate that information across the state. And I want to say that's a combination of different groups. That's a combination of the universities having input into that, the Hospital Association having input in that, the infectious disease doctors around the state that was part of an advisory group that I had to help with that. So a lot of things went into the process of getting that data and that information to know where we're at in the state of the day. So the main thing I'm here today to do is answer your questions. We're live, so we're going to do that. So I'm going to open it up. Kelly, you want to kind of call out who's going to ask a question? We'll kind of try to be organized, but I'll try to answer everybody that I can.
Yeah, we'll take turns. We'll answer as many as we possibly can get in. So whoever might have the first question, go ahead, Andrew.
Yeah, sure. Why just now? Why are you just opening questions up and follow-ups to the media now after almost about a month without really taking in-person questions?
Yeah, I think, again, just to answer that question, it's like everything else. Things are looking a little better. I think we got a better grip on how we're dealing things, what it's like to have a group of people in here, and then how do you obtain those social disciplines that we do of 10 and 6 feet apart. And it's difficult to do that. You know, one of the things we always talked about is how do we actually do that for a press briefing? I know other people do it in different ways, but it was just come to the point we feel comfortable about doing it now. And we're going to try it and see how it works today, to be right honest about it. So that's why we're doing it.
Okay?
Governor, for the final 3 weeks of the legislative session, beyond obviously the budget, coronavirus issues, what do you want the legislature to take up?
You know, I think the legislature, look, the main thing we're worried about right now is one of those supplemental, which we got done. And I want to, you know, to be able to have that budget prepared by June the 30th. I think that's the most important thing they can do right now, is try to prepare for that time. And how do we move forward? I think the other thing that's important in that is we feel like that there'll be more federal stimulus money coming down. So we got to make sure we're prepared for that. So, you know, I'm not sure what all they're going to do when they get here as far as legislative issues or what they're going to do. I haven't met with them about that. We've strictly talked about the budget, the supplemental, and what are we going to do to June, and then what are we going to start doing in 2021.
The House Democratic leader has raised the question on whether this final 3 weeks will raise partisan issues. Would you discourage them from doing that? The Senate Democratic leader has raised the same issue.
You know, look, the legislative body is a legislative body. I mean, I don't have no control over what they're going to bring up, what they're going to do, and nor do I think I should have control of that. That's their job. They're going to come back. I'm not sure what's going to be on the agenda, but again, that's going to be up to them to make those decisions.
The ACLU is filing a lawsuit asking Missourians to be able to vote by mail if they're sheltered in place. I know that's something that you really haven't been, I guess, in support of, but what are your thoughts on that lawsuit?
Well, let me first start off. That question keeps coming up and popping up, and we know what the national push of that is. But again, I think that's the Secretary of State and the county clerks. I think everybody should have the right to vote, that has the legal right to vote, under the guidelines we have today. So however we get that done, you know, again, that's up to the Secretary of State, it's up to the local level. So we're going to listen to that. Those county clerks out there will know, Secretary Ashcroft will know how to deal with that as we move forward. But again, I guess as I've said all along, every day is just a different day right now. I mean, we don't know where we're going to be come election time, even in June or August, and all those things. So every day those decisions are made.
Governor, what specifically about the Missouri data makes you feel cautiously optimistic that things are getting better?
Yeah, I think you see where the testing is, where things are starting to level off across the state. We know, for example, Columbia is very stable right now with how many people they got in ICU beds. We know Springfield has somewhat been stable. And then we know we can expand the testing capacity. We know that's coming and we're going to be able to do that. But I think the reality, what we look at, a lot of data, but one thing you had to look at early on was ICU beds. Now, most people look at the testing numbers and they'll say, okay, you did a lot of tests or you haven't done a lot of tests, or who's positive and who's not. But if you really take a look at who's in the hospitals, who's using ventilators, are we prepared for that? Are we prepared for PPE on surges? Can we put up a hospital in 2 weeks? And which we didn't know all those things, but now we do. And I think those are the critical things that help us on that.
If I may ask you about the PPE, because that's seemingly like a big part of your vision for reopening the state and drawing back on social distancing. How much PPE is it going to take for you to feel comfortable giving to first responders, law enforcement, and maybe even just people that work at stores?
Yeah,
how much makes you feel comfortable to begin that process?
Yeah, once we have to have some sort of stockpile. We're going to have some data for how many days we can get by, how many weeks we can get by. I think we're increasing on that every day. When you ask that, and I'll maybe let Director Carson, maybe give her time to answer that question too. She'll know more about that. But here's the thing of it. We also know that hospitals now can get their own PPE, and they're getting distributions. We know first responders, for example, are getting theirs on the front line. It's going directly to them. So you have to take all that in consideration. So if we say how much does the state have is one thing, but everybody else has the opportunity to get those resources, and they've been out there trying to buy that for months now. The one big thing that I think everybody should realize is the Missouri businesses that really converted over to help with that here in Missouri. And I think the one thing that I've learned from Governor of the state of Missouri, is next time around, I'm not going to be dependent on other countries, and I'm not going to be dependent on other states. The things that we need, we can do here in Missouri. And I will look at that from economic development side of it. That's going to be a business opportunity for somebody down the road to have PPE equipment, because we all need that in the hospitals and the doctor's offices. So those are the kind of things we got to do it ourselves here in the state of Missouri to make sure we're prepared for that. But if there's more questions on that, the directors are here. They can give you more details on that.
Yeah, I'd like to ask a question on that based on what you're saying, and probably Ms. Karsten. The PPEs, the defective,
Hang on just
okay, sure. The defective shipment that you got and you're dealing with now trying to get recoup costs, do you feel like that you were put into a bad position to maybe deal with a less than suitable supplier because you needed the PPEs? If it had been another option, would you have taken one?
You know, we've had a lot of vendors that we've worked through this process, over 700 on different items of PPE, and so I don't think we were put in a bad position. I think the nation as a whole was put in a bad position because we didn't have the stockpiles, the quantities that are needed. And so we are relying on another country to produce those, and we're relying on some of the differences in standards there. And so the testing that we have done in Missouri on the PPE that we've received has proven that we needed to seek other sources. So I don't believe we were put in a bad position. The only thing is that we have been we had a strong sense of urgency to get PPE out to the healthcare providers as well as to first responders, and that's where we are.
So this is for the governor. What's your message going forward to the administration on the maintenance and distribution sharing of the national strategic stockpile? Do you have a statement for them?
Well, first of all, we're going to build our own stockpile with Missouri businesses is what my long-term goal would be. And I think that's real capable of being able to do that. And we got to do that. We got to depend on ourselves, you know. We got in a bind all over the country as a whole, but Missouri got in a bind too because we're part of this country. And when we're talking about this PPE equipment that come in, these masks that were defective, you know, the bottom line, somebody took advantage of a terrible situation from another country, I want to say. I don't know that the Missouri business, this will all come out in the legal side of it. The Attorney General's on this now. But at the end of the day, I'm just thankful we caught it. I'm just thankful that the director and her team realized that those were out there, that we could recall them. But look, you know, you got cheated. That's all I can say. You know, we got cheated here in this state. We're going to have to go back out there and try to get our money. We're going to hold people accountable for that. But I also want to be able to say the FBI is working on this all over the country. You know, that we're all going to be facing these kind of things. Every state will, and even the United States government.
So are you saying that to feel like everything's rigorous and that you're safe, you're going to have to maintain your own stockpile at the state level going forward?
Going forward, I do. I think we're still going to have to purchase equipment. We're a long way from having the supply we need. I know I talked to, I'll use Cox South in Springfield. You know, the other day they were about 14 to 21 days supply. So we know what all those hospital supplies are. But every week, there's shipments coming in, whether it's on the private sector or whether it's to SEMA to going through that. Matter of fact, I know we got some shipments in today, and if Director Karsten comes back up, she maybe can talk about that. But a lot of material starting to free up. We're starting to kind of get caught up with the demand of that. But it's still challenging. It's still challenging every day.
Governor, there seems to be a discrepancy in reports today. John Hopkins reporting that there was a 400 case increase today. Your briefing earlier said that there was about 200. What is that discrepancy, and do you think that we're at the peak here, or?
Yeah, you know, look, all I know is day in and day out, if you stay with the data in Missouri, with the death code, with the positive counts, whoever's using what models, they eventually will equal out at the end of the day. There's a lot of models that use a lot of different sources to get that information. And I don't know where they come up with that information. I know if that's out there and it's true, then if it's not reported today, when we cut off at 1:30 or 2 o'clock, whenever Dr. Williams did, it'll catch up tomorrow. So, I mean, once you look at it daily, you can see it, and all that catches up with. There's only so many positive cases. I will say, too, and maybe it's a good question for Dr. Williams, if some of you want to ask, you got the private labs out there, too, every day. So they might have that information maybe before we do a lot of times on that. So I think there's a lot of variations in that, how those models look. Again, I'm just going to emphasize, we are much better off looking at Missouri data than we are other institutions that maybe is not quite as accurate as what I feel like what we're looking at in the state of Missouri.
Governor, is there a new normal that Missourians should plan for in the future?
Patience, patience. We're going to have to work our way to that new normal. I think you're going to have to understand there's going to be guidelines that the majority of the people in this state, I believe, will follow. But I think the normal life of whether you go to a restaurant, how you attend church, how do you go to a sporting event, how do we really go to a park, how do we do all these things? I think we're all going to have to take a little different look at that for social distancing, how many people are going to gather up together. And I think more importantly, people are going to drive that. I mean, the everyday citizen out there, when they start going back out and they get the ability to go back out to go shopping or to do whatever it is they're going to do, I think they're going to be pretty leery for a while of where they go. Are you going to go on a trip right now? You know, which one of the things we're preparing on that, we're saying, okay, does somebody want to get on an airplane? Do they want to go in hotels and stay right now? But maybe if there's an opportunity to put a positive spin on that and say, look, fill your tank up with gas, go to places in Missouri, visit our tourist attractions, go to places like that. I think there'll be a little bit of an alternative lifestyle as we go forward, because I think we're going to have to go patient and be cautious about it.
Governor, you said yesterday that you wanted to get businesses open by May 4th. Is that a goal, or is that like a hard and fast?
I can't hear what you're saying.
You said yesterday that May 4th was when you wanted to get businesses in the states open. Is that a goal that you'll revisit, or is that a hard and fast deadline of when you...
We look at that every day. That's our goal to get there. That's where I want the people of Missouri to know that's the date we're shooting for. And if we keep things at a minimum, as far as the positive test of who's going to the hospital, who's not, all the data we have, we're going to open up businesses on the 4th, and that's our goal to look at. That's not to say there can't be a tremendous surge. Something could happen in between that time. But right now, we got to be able to do both. We got to be able to work with COVID-19, how we prepare for that, and we also got to prepare for the economy. We probably somewhere now we're 350,000 people unemployed, numbers we never seen before. And that creates its own set of problems. When you look at Kansas City, I believe the chief up there recently just said their domestic violence was up 22%. So that's another whole set of problems you got. You got mental health issues out there. So all of that information you have to weigh out for that May the 4th date. I don't think there's anything magical about May the 4th. It was just a matter, do we have time to prepare to hit that date to get the state of Missouri open? And I believe we will. I'm optimistic to think we're going to be on the downside of where we're at with COVID-19.
And getting it reopening, to get to that point, you mentioned the 4-pillared approach where you wanted to increase testing and PPE. If those things don't happen, are you still planning to reopen the state?
I believe those things are going to happen. You know, I think those things are going to happen. And again, it's not just one particular testing thing. Testing's all part of it. But again, how many people's in hospitals? How many ICU beds are being filled? How many people's on ventilators? And the other side of it is the majority of the people, a lot of people get to go home. I mean, doctors are getting a lot more, I want to say, a lot more better at knowing what the symptoms are, and no one says, hey, maybe it's the best time just to go home for now and see how you are for a couple of days. But again, that's because we haven't had that testing ability. You're going to see a tremendous amount more tests before May the 4th. I believe that.
Well, on that point, maybe for Dr. Williams, she would mind weighing in. So I just checked, Dr. Williams, the health department's website, where you updated the testing numbers, and it's another day of sub-2,000 tests reported in that daily increase. I know the governor and you all talked about the ambitious plans to expand this the last few days. Haven't really shown a lot of ambition growth. Can you explain what's going on?
Well, you're seeing that number. The number for capacity has increased to 7,000. In other words, we look at what the labs are able to do. You remember we're testing mostly symptomatic people with cough and fevers and respiratory symptoms. We've been saying now for 3 weeks, as we got out of flu season, there would be less people being tested, and that's a national story. Now, to the governor's point, as we move from an acute phase to a recovery phase, we will change our guidelines. But what we're really looking for is the capacity. And I checked it this morning. We have about 15 labs in Missouri right now who tell us that they could do 7,000 tests a day. That's 2,000 up from about 6 days ago, as more labs come in and more labs increase their capacity. So it's just really important to keep the term capacity and how many tests. But to the governor's point, we intend to do more testing to approach that capacity. But in doing so, it won't be as many people with fevers and coughs. We will broaden that. And part of that is as we move from the acute phase, helping people know, gosh, I have COVID-19 or I have the flu, kind of a diagnostic test, we'll move more into more of a public health measure where we're looking at populations, we're looking at getting people back to work to see if they have immunity. We haven't even started antibody testing yet. So that's another component of it. And so we will do more testing. It just won't be the kind of testing for the diagnostic. We will be doing it more to develop policy and for different reasons.
On that point, one of your commercial counterparts in Missouri, G-Trade Labs, told us yesterday, they have the capacity of 20,000 tests a week, but they are short on the swabs.
Yeah.
And they're having a great deal of problems with the swabs to do the test. Is this something happening that you're hearing from labs across the state, including the public health lab, and is there any relief in that regard?
Yeah, thank you for the question. About 3 weeks ago, that was a critical logjam to the whole process. Was the labs might say we have the capacity to do this, but we don't have the capacity to get the test. The things have changed there. One is that they're developing new swabs that are now approved to do that. So that's been the one big development is. And the second is we're getting more of the swabs that we use. We just got in another shipment. So while I wouldn't say that's completely gone away, with every day that gets better. So I appreciate your distinction. There's the capacity for the lab once they get the test to do it, and there's the capacity to do the test. And that brings a third layer you haven't brought up, which is we now have almost 100 mobile testing sites throughout the state, with more coming on board, because we have built a platform in literally a month in the state of Missouri to do mobile testing. And that has all sorts of applications for doing antibody testing and to do a different kind of testing. So we're incredibly appreciative to our local health departments, our hospitals that have created completely from scratch this tremendous potential in Missouri. I just got off the phone with a health director in Springfield, and she said to me, you know, Randall, our lab can do tests in 6 hours. If that would help St. Louis, we'd love to help it. And that's just a tremendous capability that we've developed through all this.
Dr. Williams, can you kind of quantify where we are and where we need to be in terms of testing capacity, and also on any gaps in data collection to get to the point about getting localized data?
Well, our goal is to get to 10,000. We're at about 7,000 now. We have another testing modality that we have the capability to do. We're just waiting on cartridges. That will increase us by about another 1,000 to 1,500, which will get us to 8,500 a day. So as was pointed out, even our labs, and I can think of 3 or 4 who tell us they're doing a certain amount of tests, they will say if we had more swabs, we could increase that more. And Truman Medical comes to mind, and Barnes Jewish has told me that. So we think, as the governor said, the reason the May 3rd and 4th are there is it gives us a runway to set reasonable goals to get there. And that is one that we think is incredibly reasonable that we'll get there. And the second part of your question, I'm sorry.
Getting localized data, are there any gaps in terms of what's being collected that you need to address? Or?
Yeah, I think the biggest concern that we have is that one thing we hear from our local labs, our local health departments, and we've heard that today and yesterday, is they have a better ability than we do to hear about recovery and to report demographics such as race. And when we try to do that at the state level to get it aggregated across all 114 health departments, we have not had as much success there as we would like. So I've got a team working on that. They've been working on it, but they're working on it intensely today. As I drive around, and I don't drive far, just in my office and here, I'll hear health departments saying that they can, with a local, I'll just give you Cole County, will say this is how many people we have in recovery, this is how many people we have by race. We want to be able to do that at the state level because, as the governor said, it helps us so much direct our resources to the areas that we want to do that.
And Director Karsten, likewise with PPE production, do you have a metric now of how much PPE Missouri companies are making and how much you would like them to make each day or each week?
Well, thank you for the question. I'm going to defer that to Director Rob Dixon, who's been working very closely with our manufacturers on that issue.
Thank you. Yeah, every day we get data and metrics from the hospitals and obviously within the agencies within state government right now. That's being aggregated. We are looking at that and sharing that with our private sector partners as well as with the end users of PPE. This is not a situation that is going to be solved in one day. It's not going to be something that we get to some moment where all of a sudden we've produced all the PPE that we need. This is an ongoing need and will be an ongoing need for the foreseeable future. I can tell you companies large and small across the state have shifted production. Some of it you I'm sure have seen. Companies like Anheuser-Busch have started making hand sanitizer. We've also seen smaller companies around Missouri shifting from apparel manufacturing to making things like medical gowns and things like that. It is not easy to do that. It takes a degree of technical expertise for companies to change their production model on a dime. There are FDA requirements, certainly, that they have to be aware of. So it is not something that happens overnight. But I'll tell you, Missouri businesses right now are ramping up. Every week we send those over to our partner agencies and state government, as well as to the hospital system. And it's a key metric that we're all tracking.
Thank you.
Dr. Williams. Governor Parson, you talk about the state opening in phases and kind of rolling it out. Are there any areas that you think could reopen sooner, and what would those areas need to do now?
Well, I think, again, you're already seeing some areas that won't open up like probably the way I'll open up the state. You still got St. Louis, you still got Kansas City, you'll have mayors making those decisions too. I think what I'm going to try to do is what we will do, I guess. We're going to give the guidelines for the state. And then every local entity will have an opportunity to change that if they want to change it. So if they want to do stricter, they can do stricter. So the mayors, the county commissioners will all have a choice to do that. However, I think it is very important that we have a set of guidelines that everybody can go by, that we kind of know how we are going to open. For example, going from an essential business to a non-essential business, let's just say a box stores, the big box stores, for example. How does that foresee, how do we open them up? And my first suggestion would be is we open up the same way. You're going to be a limited number of people going into big box stores, no matter whether it's a Walmart, whether it's a Lowe's, whether it's a Home Depot, or wherever that might be. They're going to follow in the same guidelines. If it's the pharmacies will probably be limited to how many people can be in the stores. Things of that, I think, will continue to go on. But we will try to make a blanket policy for the state of Missouri for guidance and to see where that leads us on. So hopefully that answers your question. The other thing before I answer the question, I want to give AJ a shout out up here. He's been working hard up here for me for about a month or so on that. He doesn't get much glory up here on this at all, on what he got into, but again, just one of those days we're trying to communicate and be transparent as we can. So I thank AJ for being up here. All right, back to questions.
Governor Parson, on a similar note, there are several counties across the state that have stay-at-home orders that are expiring before the statewide one on May 3rd, and they are choosing not to renew those and extend those. Is that May 3rd date, does that supersede the counties that may have one, say, expiring next week?
Well, ours would still be, whether the counties do or not, our order would still be in effect. You know, from the first order we did to the second one, the changes we made. So our order's still in effect. We would hope, and I believe they will, we talk to mayors all the time, talk to mayors today, across state, county commissioners. I think you'll see a lot of people lining up with that May 3rd a date. Simply on the federal side where they put May the 1st, you know, I think people are going to start looking at that day as really to how we start moving forward in the state. But again, I want to say every state, I'm not sure what all the other states will do. I mean, other governors will do different things, how they do it. But, you know, I'm going to focus on Missouri, trying to make sure we move forward to take care of Missourians. But I think people will follow suit. But I think it is important that we make sure the public knows what those guidelines are. Because I don't think what you want to be doing is going from one county to the other in totally different guidelines. And that could have an effect we really don't want on that. It goes back to that essential businesses where we created that funnel effect, where we created essential businesses early on. You know, we all thought a stay-at-home order and essential businesses was good, which it was a good thing, and I credit the people that done it. But it also created another problem because we started funneling everybody to a selected number of businesses with no adequate numbers of how many people could be there, and we really just started bunching people up, which made the situation worse in those areas. So we don't want to go back down that road again.
I promise, this will be a simple process, policy question for those of us who have covered the budget. Are you planning, considering a formal revised proposal to the legislature to deal with a $500 million or greater shortfall, or is that something that's going to be worked out in the middle of the process without a formal change from you?
Look, doing the budget is going to be a difficult task. I don't know that a $500 million gets it. You know, I think right now, there's a lot of unknowns out there, but I would say if you was looking at what I would say in the budget today, you're probably looking at $1 billion deficit. Now, that's what I would say, what my people are saying to this day. What the unknowns are about that, Bill, is we don't know how much federal money is going to come in to help backfill that. So we don't know where we're at that. So for me to be able to say how a budget's going to look today or a week or two from now, I don't know how you do that, because I don't know what all is going to be coming in between that time. I don't know what will come in on the federal level in June, for example. You know, how we're going to do that. But I know this much, I've never seen a deficit like that. And it's going to take some time to figure out how we go through that and how we put a budget together. And the legislature's, you know, it's going to take some work.
In order to tap into the rainy day fund, it takes a recommendation of you and then 2/3 of the House and Senate. That would offset some of what he just mentioned. Would you be willing to do that?
Yeah, we're going to look at all resources to how we fill the gap to move Missouri forward. You know, thank goodness last year when we put the $100 million in there that we had in case we needed for problems in the state when we first, it had not been done before, and we put that in there last year. Thank goodness we had that in there to fall back on. But, you know, look, we're going to have to use a lot of resources here to fill the gap as much as we can, because the problem is, as we all know, on the federal level, it's simple. You go out there and print more money and you say, okay, we can put more money out there at the end of the day. But state, we can't do that. And if you don't know what those numbers are coming from the federal level, it's a little tough to build that budget when you got that kind of deficit. So again, it's just, we got to fall within the lines. We got to use what resources we got. But like everybody else out there, you know, we probably are going to have to dig into our savings to pay the bills. As I look around the state and hospitals call in here and small business owners and people call in saying, hey, I've got a cash flow problem. Well, you know what? A lot of us have cash flow problems right now, you know, including government. The cities do, the counties do, the state does. Everyday people have that. And, you know, we're just going to have to be pretty wise how we spend our money right now. And again, we're only going to be able to spend so much because we only got so much.
We have time for probably about a couple more minutes. Kurt, do you have one?
Good.
Go ahead.
It's a question for Dr. Williams. Dr. Williams, the National Association of County and City Health Officials estimates that departments need 30 people per 100,000 population to effectively contact trace. Do you think the state is anywhere close to that number? And if not, how do you plan on getting close to that number?
I'm sorry, the 30 what? Need 30?
30 people.
People, okay, yeah, thank you. Yeah, as you know, one of the pillars, in addition to testing and PPE, is robust epidemiological. The governor talked about the predictive analytics. And those predictive analytics are used to figure out where you're going to need PPE, tests, and staff. So our plan on that, I was speaking to my colleagues yesterday, Lee Norman in Kansas, is that, as we did in the beginning of this, is to use our local health departments and use the state as kind of a strike team to go into those areas. Because we think going forward, the most likely scenario is we're going to have clusters around the state as we move into a recovery phase. As the governor has said, it will not be like a light switch. And what we have to do, our strategy is called boxing in. That as soon as we have an outbreak in a community or a nursing home or an area, we have to apply a strike team to that area. We have to test them, we have to have the PPE to do that, and we have to isolate them and do epidemiological contact tracing. So that's our model going forward. But as the governor said, the fourth pillar of that, which we are doing a great job in Missouri, is trying to predict, based on certain things, where those might occur. And then, as I was saying earlier, shift resources and help our local health departments, who so often are the tip of the spear in those efforts. And again, I would just be incredibly remiss if I did not say how wonderful and hardworking and committed they have been at our local health departments, and including their backup here at the Department of Health and Senior Services, to doing that contact work. It is just so important as you're trying to mitigate and keep the disease from rebounding back. So thank you for your question.
Dr. Williams, I have another question for you. I think it was the AP reported today that there were about 400 new positive cases of the virus in Missouri. It's been mentioned that it's possible Missouri has reached its peak. Has Missouri reached its peak?
Again, thank you. What we see is, if you look over like the last 8 days, we see what we call a hockey stick, which is it's going up and then it kind of bends to the right. And so when you look at the rate of new cases, so remember, 200 new cases is one thing if you've had 5,000. It's another thing if you've only had 100. It'd be a doubling there. 200 when you've had 5,000 is much, much less of a percentage. So we watch that very carefully. And so that is cautiously encouraging to us. And as the governor said, we don't so much look at a day-to-day thing, we look at 3 or 4 days. And so when we look over the last 8 days, that's very encouraging to us over. But as the governor keeps saying, it would be a huge mistake to look at that and take your foot off the gas and just say, well, okay, that if we're going to get to the daylight that May 4th represents, we have to keep doing what we're doing, or it's all for naught. So we're so appreciative of the people of Missouri who've made it happen, but we need to keep doing it.
Thank you. Governor, do you have a few closing remarks?
Let me add one thing to what Dr. Williams said on the testing. Again, we get involved with the numbers of testing. That seems to be a lot of times what we want to use. I think it's also important for companies like Quest, for example. They don't dump their information on a daily basis. So you literally could get that information that they've had for 2 or 3 days, and you'll have that spike of different people. That's why I say it's very difficult to do the day by day. You really got to look at that a week at a time, at days at a time. Otherwise, you're going to get some false readings, like all of a sudden you think, oh man, that was a lot in one day, but you also might see the next day was extremely low. So that's why it's important that you average that out and you see that for days at a time to know what that testing really is. So I just want you to know that in the private sector, because that happens several times a week where they won't turn their stuff in for 4 or 5 days, and then you get a dump of it that comes in, and those numbers go up on that. Listen, I want to thank everybody for being out here today. I'm glad this all worked out as well as it did. I hope it did for you. I know Kelly's been working on this, trying to figure out how we can do this, how to manage, how we move forward. So maybe this is something we can continue to do at some sort of basis, getting with you to figure out how to do it. The main thing, no matter if it was you or it's anybody else in here, you know, my main one goal is trying to keep people safe. And ever since this has all started, we've come to work every day at the governor's office, and every day I focus on trying to keep the people that have to go to work in the state, to keep them safe, along with you that are in here today. It makes a difference no matter who you are, so we try to provide that safety blanket. So we will continue. I'll let Kelly decide on how we move forward on this. But again, thank you for being here today. Thanks for giving us an opportunity to tell the people out there what's going on in the state, because right now it is important that they understand what the real facts are in this state, why we're going where we're going, and how we're going to get there. And I think that's important for everyone to know out there. So again, thank you very much for being here today. Thank you.